legislature.
Thanks for watching TMA's Legislative News Hotline for Friday, February 6th. I'm Brent Anier. TMA physicians sent legislators an urgent message this week: help us care for our patients. TMA and Border Health Caucus doctors called for action on Tuesday. Physicians from across the state joined TMA President Dr. Austin King to discuss obstacles doctors face as they care for patients. Problems like red tape and bureaucratic hassles, limited networks preventing doctors from referring patients, and low pay, all which amount to limited access to care for Medicaid patients. Dr. King suggested the state could spend Medicaid dollars more wisely and efficiently.
As I tell you, when you talk to people here in the Capitol building, Medicaid is all about facts and figures and accounting. But I can tell you Medicaid's about people. It's about physicians wanting to take the responsibility of caring for people in their community to heart, and to do that, it's about patients wanting to be able to access that care.
Dr. Doug Curran, TMA Board of Trustees Vice Chair, described the difficulties his medical practice had trying to enroll 2 new young physicians into Medicaid.
Trying to get them on Medicaid, a program that needs to have those young family doctors on them, took 6 months to get one of them on and 9 months to get the other one on. Credentialing is impossible. You have to credential for each HMO individually. You have to credential for each program individually. It is a nightmare. I finally had to call the commissioner's office to get it done. It was impossible.
Dr. Michael Batista, a member of TMA's Council on Socioeconomics, summed up doctors' frustrations, while Dr. Luis Benavides, Vice Chair of the Border Health Caucus, said Medicaid HMOs routinely deny prescription medications he's trying to get for patients. For example, he said he struggled to stabilize one diabetic patient because Medicaid changed the drug formulary.
Come January of last year, her insurance changed formularies. They no longer covered that. Had to try and control her on something else. A couple of hypoglycemic episodes later, a couple of ER visits later, 1 hospitalization later, I was able to stabilize her. But for those 6 to 8 months, her life was not what it could have been. She suffered simply because I had no way of getting that covered.
The other common theme has been the hassle factor, red tape. My colleagues have already addressed the provider enrollment issue, 6 to 9 months. Physicians are still caring for their patients, yet we're not getting paid. The denial issue is major. Specifically, I'll give you an example I deal with, my group deals with every day. We spend on average an hour a day dealing with denials for hospital days and charges. Yet 95% of those charges are ultimately approved. So you have to ask, why does that happen? So what we see is we're seeing fragmented care that is not coordinated, it's costly, and we're not taking good care of these patients.
The doctors asked lawmakers to take steps this session to address these 6 issues: improve physicians' Medicaid payments, cut Medicaid red tape and administrative hassles, hold Medicaid HMOs accountable for establishing adequate physician networks to care for patients, restore funding for Medicaid, Medicare dual-eligible patients, stop unfair and unreasonable fraud and abuse audits, and find a creative solution to pull down federal dollars to ensure working poor adults have access to health care. Improving Medicaid was just one of the many points physicians, medical students, and Alliance members delivered to legislators during TMA's first Tuesdays at the Capitol event this week. More than 300 Voices of Organized Medicine visited the Capitol and met with lawmakers. Many also attended the news conference, and some also spoke with news reporters themselves. Legislators take note when 300 white coats fill the Capitol in their offices, so mark your calendar to join your colleagues for the next First Tuesday events, March 3rd, April 7th, and May 5th. That's it for this week. Thank you for watching. I'm Brent Anier with TMA. Please join us again next time for TMA's Legislative News Hotline.